Hi, I'm David Feldshon. I'm a gastroenterologist at Minnesota GI, and I'm also certified by the American Board of Obesity Medicine. New patients come into our weight management program for many different reasons, sometimes not realizing how far-reaching the medical risks associated with obesity are. I've put together this presentation to highlight the long-term benefits to weight loss.
Obesity definition is a BMI of greater than 30. Severe obesity is a BMI greater than 40, and that's considered class 3 obesity. Abdominal obesity is a more severe form of obesity, and that's defined in an American as greater than a 40-inch waist circumference in men, 35-inch waist circumference in women, and you can see on the picture how to measure that. Notice that there are associated conditions with obesity: diabetes, hypertension, heart disease, or high cholesterol. If you total up any of three of those, you have what's called metabolic syndrome, and that's something with a more severe course. So this is what a gross fatty liver looks like. A normal liver on the right, and fatty liver is kind of greenish yellow on the left, and it's because it's all infiltrated with fat. NAFLD, NAFLD, just means fatty liver. NASH actually means steatohepatitis, and it's an inflammatory condition in some patients with fatty liver that seems to lead to cirrhosis. And this is just a microscopic view of liver cells just full of fat. And there's probably a genetic predisposition to fatty liver. So someone who has a family member with this, I would think that the rest of the family is also at risk for this condition. Essentially, all patients with a BMI over 40 will have fatty liver or NAFLD. Up to a third of fatty liver patients have the inflammatory condition called NASH, and those patients are at risk for cirrhosis. Over time, about 60% of NASH patients will have cirrhosis after 20 years, and there's about a 50% chance of decompensation and death once a person has developed cirrhosis. Look at the curve on the left. As the BMI goes up from 25 to 40, the mortality goes up in an exponential fashion. What I can translate that to is a tripling of mortality by a BMI of 40. Average mortality per year in adults is about 0.75%, but tripling that is about 2.3% per year, or about 25% after 10 years. Let's talk about sleep apnea for a minute. This is someone who's wearing a CPAP mask, and you know that straps firmly onto the face. Many people simply can't tolerate CPAP because of that restriction on your breathing. So it turns out that obstructive sleep apnea affects about 60% of men with a BMI over 30, about 22% of women with a BMI over 30. But in the more severe form, sleep apnea may have a 30% mortality over 14 years. It is completely reversible with adequate weight loss. There is an increased risk of diabetes and an increased mortality if sleep apnea is associated with heart disease. What about heart disease? Average risk MI, midlife male, would be about 5.4%. If the BMI is over 30, that risk doubles to about 11.4%. What about diabetes itself? Diabetes affects about 3% of people at a healthy weight, BMI less than 25. That risk quadruples with a BMI greater than 30. If one has diabetes, that doubles the risk of developing heart disease and all the complications. So take that heart attack rate before and simply double it. That would be up to about 20%, 25%. Notice that diabetes is about 50% reversible with a 25% weight loss. That's 25% of total body weight. Hypertension. And of course, this gentleman's eating all the wrong things and smoking to boot. Well, hypertension risk at a normal weight in our country is about 20%. So affects about 1 out of 5 people. That risk more than doubles with a BMI over 30 to about 42%, or almost half of the population. And of course, hypertension is associated with heart disease, stroke, etc. Arthritis. Interestingly, the knees are the most affected by weight. The hips are surprisingly unaffected by weight. But knee arthritis affects about 19% of people with a normal BMI. That risk triples with a BMI over 30, or about 55%. And obviously is responsible for an explosion in the knee replacement orthopedic industry. Dementia. This was a surprising one for me, but dementia is related to midlife obesity, midlife being between ages 30 and 50. What seems to happen is that everyone is at some risk for dementia, and it's probably about a 6%, 6.2% risk between ages 60 and 70, but that risk doubles in the later years if one was obese in midlife. And that risk keeps increasing with age. Eventually, the risk among all people is about 50% once you're into your 90s. There is some data to suggest that there's improved memory with active weight reduction. So once one does have dementia, it's not completely irreversible. Obesity and cancer, there's a well-recognized association. The example of uterine cancer is on the left and an obstructing colon cancer is on the right. Turns out that multiple cancers are associated with obesity: uterine, colon, breast, and renal cancers. Uterine cancer risk may increase as much as 40% with obesity. Let's mention sexuality and obesity. Erectile dysfunction increases in men as they age. There's probably a 30% risk in the 60s, but if one is obese, that risk goes up to about 40% or 1/3 higher in men in their 60s. That risk will increase to 90% of erectile dysfunction if the metabolic syndrome is present. The dysfunction may be reversible with weight loss. Women are also at risk in terms of fertility. They develop polycystic ovaries with infrequent menses, and interestingly, the polycystic ovary problem does tend to get better with weight reduction. We do have 2 diet options at Minnesota GI, and these are comprehensive weight management programs, OptiFast and HealthWise. They both are for 18 weeks. OptiFast is considered a full meal replacement regimen. The HealthWise is a partial meal replacement regimen. Our results with multiple patients over time is that we have about a 20% loss of total body weight in the OptiFast patients throughout the program. HealthWise, there's about a 15% loss of total body weight. And the program currently is 18 weeks, although we are planning on expanding it. A new weight loss device, which we are quite excited about, was just approved by the FDA last August. It's a gastric balloon. It's placed endoscopically, kept in the stomach for 6 months, and then removed. The average weight loss associated with this device is 10 to 15% total body weight. It's actually been available in Europe and South America for up to 20 years and appears to be quite safe.
Minnesota GI understands the health and quality of life benefits of reducing weight and has created serious solutions with our medically monitored weight management programs and weight reduction procedures. Detailed information on these programs, as well as a range of expected results, can be found on our website at mngastro.com. You can also call us for an initial weight management appointment, which is scheduled at our St. Paul Clinic location. Thanks for watching.